Welcome to this video in which we want to discuss force technology that has been introduced into clinical practice in 2018 and is now in a limited edition available to 3 European centers. And with me in this discussion is Geert Willem Schurink from the University Medical Center in Maastricht and Joost van Herwaarden from the University Medical Center in Utrecht. And these are the 3 centers using force currently in Europe and have reached a number of 100 cases so far performed with force technology, mainly in aortic cases with fenestrated and branched devices, but also some peripheral cases have been done. The first in-human study that was completed in 2018 has been followed by a registry in which all cases are included that have been done since the introduction of the technology with the CE approval from January 2020. And I'm very happy that we have opportunity to look at some case examples highlighting the most interesting features of force. And Joost van Herwaarden from Utrecht will start showing us his experience as he's seen the light from the earliest development of this groundbreaking imaging technology.
Force technology is able to show O35 wire and catheter with the use of light instead of X-ray. It has several advantages, to my opinion. One, of course, is that we use light instead of X-ray, but the other ones are that we have a 3D view on the catheter and the wire, and we can also use it in a biplane mode. So that are some nice features that are really advantages of this new technology, and we're happy to use it indeed since 2018 now. But Geert Willem started more recently with this technology.
Yes, yeah, Joost, thank you for and Tilo for the introduction. I'm very glad that I'm involved in this very exciting journey. Although you might think that radiation reduction is one of the biggest issues, I think one of the biggest advantages really is imaging advantages. Of course, with force, what we are doing is we using mostly 3D overlay. Most of us are used to this technique in a combination of X-ray. But now you can do the same by using force in a 3D image. And like you said, you have the opportunity of splitting the image and have some kind of virtual biplane where your second image is a completely different projection than the C-arm position is. And I think we have some cases to show. You see an example of a split image. The left image is the position of the C-arm. During cannulation of this left renal artery using a steerable sheet, we used X-ray to position the steerable sheet, but you already see the position of the steerable sheet because the force wire and catheter are inside. And as you can see in both images, you have an AP view and some more lateral view. The ostium of the arteries are marked, so you can really aim at your target vessel. And if you look at the second video, we had a little more confidence. So in this video, we didn't use X-ray at all to change the shape of your steering sheet, the steerable sheet. So we aimed it at the ostium of the superior mesenteric artery, and you see in both directions. And the right one is the virtual lateral position. You can see it's in the SMA, and the guide wire goes in, catheter follows easily. So I think these are two short examples of the imaging advantages of force.
It has been quite similar for us. In the beginning, we felt most comfortable as long as we had a fluoroscopy image underlying the false materials. As you showed, it is also possible to do parts of the procedure without any background of a fluoroscopy image. It is more that we have been used for years to have always this black and white background image, but we've also sometimes skipped this now. The advantage of radiation reduction is significant, but I agree with you that the workflow improvements are even more important. If we look at the short video that I have prepared, this is a case where we used force in a more complex case with 6 fenestrations, and you see that some of them are already in place. And what we see here is similar to Geert's example that we use the biplane mode or the split image mode. And you can see that the full catheterization of the celiac artery here can be done in an AP view. So we don't even have to turn the C-arm around. And we stay in the AP mode, which completely obviates the need for a lateral view. And these lateral views really have the biggest impact on radiation on the procedures. And our experience is so far that we have cut the radiation dose area product in half for the fluoroscopy part of the procedures. And I believe this is mainly due to the opportunity not to use the lateral views any longer. Joost, can you tell us a little bit about other areas like peripheral cases? I remember seeing a case in Utrecht where you even used force in a iliac and peripheral situation.
Yes, I'm happy. I prepared indeed 2 peripheral cases. This is a lady who came with severe claudication, and she had an in-stent stenosis in her SFA. And as you can see, we started with an angiogram, and one of the benefits from this technology is that the wire is shown in yellow and the catheter in blue, and that means that you can just use the regular angiogram. So you don't have to paint on the screen or use a smart mask feature, but you can just use the angiogram. And I really prefer that. And another advantage is that we saw the biplane mode earlier. So now we will show you also the lower leg, because we made an angiogram of the vessels above the knee, but also of the vessels below the knee. And you can see them, show them in one image, in one view. So one of the nice advantages of this technology is that the view on the catheter and wire are not limited to the field of view of the detector. So as you can see here on the left side, you can see the catheter and wire go through the SFA. And then on the other image, you can see the catheter and wire entering the vessels below the knee. And you can see it all at the same time. And you have full control of catheter and wire and full vision, and not limited to the field of view of the detector. And here we see a second case. This patient had an occlusion of his iliac stent, and we tried to do a recanalization. And here you can see again a biplane mode. So there are 2 different viewing angles, and I could see quite easy that we did not make any perforation, and we stayed inside the stent from 2 different angles. You can also see very nicely the white dot on the wire and on the catheter to see more precisely whether the devices point towards us or to the back. and that makes doing these procedures, to my opinion, a bit easier. Of course, it took some time, but at the end, I can tell you that we finished this recanalization, and also the catheter followed the wire very smoothly. So I think one of the advantages that you can use every X-ray image as an overlay. So we have seen in the aortic cases, we saw the preoperative CTAs that were used together with an X-ray of the stent graft, the fenestrated stent graft, that we could see all the fenestrations. In the previous case, we just used an angiogram. And in this case, we just used 2 plain X-ray images. And I think that's also an advantage of this technology, that you can use it together with all kind of X-ray images.
Yeah, I think we showed some beautiful cases during this video. And as you told us in the introduction, at the moment we're a little bit limited by 0.35 guide wire and 2 catheters. But I think if this technology expands and 0.18 guide wires are developed, and we can use different catheters, also other fields as cardiac interventions and perhaps neuro interventions will be suitable for the FORCE technology. So I think we are now at the very beginning of this journey, but I think there is a lot to gain in the endovascular world. Do you agree, Tilo, or do you see other advantages?
It was a development in the beginning. I thought really the radiation reduction is what we aim for most, but the workflow improvements are for me the biggest gain. That I use the angulations less, and that saves time and radiation. Of course, it's also very nice to look at the color images and to get this 3D visualization tool. As you also said, you see the white dot that points towards you when you go ventrally. It's very nice to use, and it is helpful.
I also like especially the biplane mode, but I had to get used to using that. Do you have the same experience? That it takes some time before you really feel comfortable with a biplane mode?
I think it's really a learning curve, and it becomes very normal to have this biplane available. Sometimes I wonder, as we also use multiple views when we work on our workstation planning those cases, we are used to have multiple windows. If we can have a third one or a fourth one, or in the end have a real 3D visualization. For now, the 2-plane is really nice, and I think will become the standard of our work. Thanks a lot, Joost and Geert. That was a very nice discussion. I enjoyed seeing your cases, and I'm sure we're going to continue that discussion, and many more users in the future, also from across the Atlantic, will join the discussion on how to best use FORCE. And I look forward to our further improvements and hope to see you all soon.